Gentlelady from North Carolina, Ms. Ellmers, 5 minutes, Professor.
Thank you, and thank you, Madam Secretary, for being with us today. I'm sorry, you've got some water there? We should get you some water. I do want to address, before I ask, I have 3 different, very different questions to ask you about, but I do want to address the issue of Medicare and our seniors who are concerned. It is my recollection, and you know, there again, I'm just going back to history, that over $700 billion was taken out of Medicare in order to pay for Obamacare. About $300 billion of that was Medicare Advantage. So to the question of whether or not our seniors are concerned about that, I would say yes. They are concerned about that, and they want to make sure that they will be able to continue to get the good care that they deserve. I do want to start off by talking about Medicare reimbursement in relation to the 2% sequester cuts that were put in place a number of years ago, dramatically affecting our chemotherapy drugs and our other Part B drugs. As you know, this has affected our industry. Back in January 14th of 2013, Office of Management and Budget put out a letter basically asking federal agencies to, quote, use any available flexibility to reduce operational risks and minimize impacts of the agency's core mission and service of the American people. And it goes on. Some of the adverse things that have happened as a result of the 2% cut over 16 months after CMS started applying the 2% cut, we basically ended up with 25 community oncology clinics closing, one of which a very large clinic in my own district, and 75 others merged with hospitals. CMS own numbers show that it costs $6,500 more per year per patient on oncology services if they become part of the hospital system versus the clinic setting or outpatient setting, and about $650 more out of pocket. How can this, you know, why hasn't CMS taken the recommendation of OMB and addressed that situation?
Congresswoman, we agree with you about sequester, and in this budget, we fully get rid of sequester both on the mandatory side and on the discretionary side. We believe there are other choices that are better choices, and so agree with you. This is not an approach. When you use an approach like this, you end up doing things like the types of things you're talking about, and so what we want to do is fully replace it, and that's what our budget does. We are willing to make other choices in terms of how we get those savings.
Thank you, and I'll just go on, and this, there again, a very important question having to do essentially with our tobacco products. My question for you is, do you agree with Mitch Zeller, Director of FDA's Center for Tobacco Products, that if the smokers, and I'm going to quote him, who are otherwise unable or unwilling to quit were to completely switch to smokeless tobacco products, it would be good for the public health? Do you agree with this statement?
I would have to understand the context in which he made that statement. With regard to the question, I think, you know, we want to promote the public health. We want to make sure we're doing the right research to understand that and put in place the right guidelines and regulations to do it.
Well, thank you for that. And I do want to add there that there are no government websites that help promote or, you know, address this issue, including CDC, FDA, NIH. It would be helpful, again, for the public to understand that there are the non-tobacco products available and that this is an approach that we need to make. And I would welcome the ability to continue to work with you and your office on any way that we can, you know, better help to get that information out and address the needs from a scientific basis, and using the scientific research that's out there. I do want to switch gears a little bit to our vaccines and to BARDA. Right now, BARDA maintains a stockpile of roughly $1.7 billion worth of pandemic influenza vaccine. This year's budget, I believe, was about $20 million in order to take care of that stockpile and maintain it. Does the 2016 budget increase that amount? And into the future, how does BARDA plan on dealing with those issues, especially when we know that we are in our situation where this is a very timely issue?
Across the board, our budget has worked to do a couple of things with regard to the preparedness, making sure that vaccine stockpile and that the issues that BARDA handles, which are making sure that we have what we have on hand in stockpile and that we have the ability to work with manufacturers to bring new products online where that's appropriate for different types of issues that we as a nation may face, either man-made or otherwise. But we also have paired that with things in our budget which are about the preparedness in our communities, and we've seen that front and center, certainly in our Ebola time period. We are implementing the dollars we appreciate from Congress as part of that in terms of Ebola, but also broader preparedness where we have been given that authority by the Congress.
Thank you, Secretary Burwell, for being here today. I truly appreciate your input. Thank you.